Welcome to the Mind Vine podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery. Leading us on this journey are the hosts of the Mind Vine podcast, Darryl Mathers and Chris Bovie.
Welcome to the Mind Vine podcast. My name is Darryl Mathers, and I'm with my co-host, as usual, Chris Bovie. Welcome.
Hey, Darryl. I like to see that you got a brand new backdrop there. Did we have some budget for?
No, this is my.
Oh.
I think this is my 7-year-old's former curtains.
Okay.
We have 5 of us in the house trying to work, and I get the last straw. I get the garage, which is actually quite comfortable. I've spent most of the pandemic trying to make my garage as comfortable as possible. But
sounds good.
This is it. So it's held together by zip ties and super glue and everything else.
The MacGyver of podcasts.
Yeah, whatever it takes. So this podcast, I mean, we'll get right into it. It's a little bit different than what we normally do. We normally always have a mental health kind of focus, obviously being Ontario Shores and a mental health hospital. And this one, may not be as obvious, but we're going to talk vaccines. We're going to talk COVID-19, and I can see the link to mental health because if this thing doesn't end soon, my mental health is going to deteriorate even more than it already has. And vaccines are not the only strategy, but they're one that's out there, and we need to, not only for our staff and our community, but it's vaccine season, and we need to talk about it.
Absolutely. So
that brings us to our guest as I try to work the controls in my garage. Pleased to welcome our guest, Dr. Darryl Ricciuto. He's an internal medicine and infectious disease specialist at Lakeridge Health, as well as physician lead for antimicrobial stewardship and infection prevention control, and the chair of the Pharmacy and Therapeutics Committee at Lakeridge. There, almost got it out without stumbling too much.
Welcome, Dr. Ricciuto.
You get the point. He's another infectious disease specialist who's in high demand. It's almost like the Academy Award season for infectious disease specialists. They're on City TV and CTV and everywhere because people need to know the information that they're specializing in. So pleased to welcome Dr. Darryl Ricciuto.
Welcome. Thanks, Darryl and Chris. And maybe I'll just provide a bit of an update. I think the roles that you had me in are from a little while ago, and so just before the pandemic started, my primary roles have been switched to infection prevention and control. So I'm the medical director for IPAC and actually working now with other facilities across the region as part of an outreach program, what we call our IPAC hub. And I'm also the medical director for our quality and patient experience team at Lakeridge, and have a role with what we call our COVID response team, which is a trio of us that are helping with the COVID response from the hospital base. And so, yeah, you got it. It's been the last 15 months of nonstop COVID, all day, every day. I'm tired of it as well. So vaccines do potentially give us some opportunity here to finally get over this.
Yeah, I mean, we'll just start with, it's all over the media, the vaccination campaign. Obviously, at this point, it's what's going to get us out of here. It's not the only thing, but it's one, probably the biggest tool that's going to get us out of here. As simple as why should somebody get vaccinated against COVID?
Yeah. So I think right now there is a lot of COVID circulating, right? So it's as bad now as it has ever been through these last 15 months of the pandemic or so, or just over a year, I guess. So your point about, it's not the only thing that's going to get us through. I just want to reemphasize that right now we still need to really be good at these other public health measures with masking and distancing and hand hygiene and making sure we're not getting together in large groups, because even with vaccination, the rollout is just not fast enough to be the only thing that gets us through these next couple of months. down the road over, after these next couple of months, I think vaccines are going to be what really keeps us out of it. So your question about why get vaccinated, what is the reason why, and I'll tell you why I got vaccinated when it was available to me. And there's a few different things. So for me as a healthcare worker, right, I see patients as well. I take care of patients, and a lot of them are quite vulnerable, and are in the hospital where outbreaks may occur. I took an oath that I don't cause any harm to patients. So I have specifically from that perspective, I know that being vaccinated, I have a lesser chance, a significantly lower chance of acquiring COVID and subsequently then passing on the infection to others. So that's one big thing. Along the same line as that, I have elderly parents, I have a family. I don't want to pass it on to them. What if I pick it up at work and I bring it home, or bring it to my parents and they develop severe COVID? I mean, I don't think I could, I would feel really terrible about that. And I want to do everything that I can to prevent that from happening. And, vaccination is one of those things that can significantly decrease that risk of transmission. Then, there's the part of, I'm not that young anymore. The risk of personal risk of COVID is actually relatively high with respect to admission to hospital or ICU admission. And I want to be able to prevent that risk. And vaccines have been shown to be really good at preventing that risk, if not 100%, but up there, 90+% at preventing these severe illnesses. And along the same lines, I think we don't talk about it enough, but I've seen a number of patients now that are younger that have had COVID, and their symptoms even weren't that bad. Like, they felt pretty miserable, but not that bad. But now are like months and months after the initial diagnosis that still have symptoms. Some can't go back to work. And then this is this long COVID or post-COVID syndrome. And that's a real thing. That is not something certainly that I want to have. And so I think some of those are the main reasons. So I guess the last reason, right, which is probably what you alluded to, is to provide some community immunity, to have herd immunity against COVID, so that if enough people within our communities get vaccinated for COVID, then you can keep it away. That means that, this summer cases will come down. And then instead of what happened last year, where in the fall cases started going back up again, in fact, the cases, we can hopefully keep them down if there's significant herd immunity. So, I mean, those are all the reasons why I'm vaccinated, and I think they apply to most everyone else as well.
So, I mean, there's so much information out there, and in the social media age and media, and talking about the different vaccines and AstraZeneca and clotting. Like, I wonder if you can kind of clarify a little bit, because I think, for example, the AstraZeneca, a lot of people may be waiting to get the Pfizer at a clinic and not taking the opportunity to go to their pharmacy. And if you sort of dig a little deeper, the risk of clotting is probably higher with birth control and different things. Can you maybe shed some light on that, just to talk about sort of vaccine hesitancy with different products?
Yeah, no, it's great, because it really has been in the media lately. So I think, a few things. The vaccines are super safe. So there's almost 1 billion people that have been vaccinated across the globe. At very least, in the Western world, CDC, Canada, Europe have really good data on collecting data on adverse events after vaccination. And that's why some of these super rare things have been picked up, whereby normally we wouldn't pick them up if we didn't have good surveillance and there wasn't so many different people vaccinated. So I think your point is really important, where we have to look at this in context. When you're hearing media reports of these clots, some of which are serious, you have to look at it in the actual context of the risk benefits of the vaccine. So, for instance, with AstraZeneca, there's this type of blood clot that can form, and is through the specific reaction actually to the vaccine, similar to a type of reaction that people get with a blood thinner called heparin, that happens sometimes with people in hospital. But it happens in about 1 in 100,000 younger individuals. So that's like 30 to 40-year-olds. And then it goes down over time, and it happens in just a fraction of that in those that are 50 and older. The same types of clots now has been shown through a review that if you have COVID infection, are about 8 times as frequent. So you actually can prevent 7 times, 7 times as many clots as you will get through that specific vaccine, the Astrazeneca vaccine. Then, if you look at things like ICU admission, for preventing one clot in, let's say, a 50-year-old, you're going to prevent 100 ICU admissions, and so I think that's one of the other consequences. 200 ICU admissions in 50-year-olds. So I think when you really think about the risk benefits, it's clear that right now, when there's really high transmission of COVID, that the benefits far outweigh any risks of vaccine. And I think we have to keep these types of things in context. And then I think your question about the different types of vaccines, there's now really good data on all of them. I've told my own family members, like, go ahead and get whatever vaccine is available at this point in time, because the risk of COVID is so significant. I mean, I think there's a couple of differences between the 3 vaccines currently available. So there's the 2 mRNA vaccines, and that is the Pfizer vaccine, and then the Moderna vaccine. Moderna's we've not had as much of it, at least in our region, as the Pfizer vaccine. So those ones work really well. In the phase 3 studies, they have about a 95% protection rate. 1 dose of those, which is now recommended up until 4 months when you get the second dose, still has good protection. That's probably more like 70 to 80% versus versus the 2 doses, which is probably more in the real world around 90%. And side effects of those are very rare. Most common things are sore arm, muscle aches, sometimes fevers and chills, especially after the second dose. But those are the most common things that people get. The most significant severe side effects would be anaphylaxis, but that's somewhere in the range of 1 in 250,000 or something like that, which is quite similar to any other vaccine and lower than things like penicillin, for instance. And so overall, it's been quite safe. The AstraZeneca vaccine, also, they've not been compared head to head, but also is quite effective. The effectiveness might be a little bit lower against symptomatic infection, but the effectiveness of preventing severe illness seems to be right about the same as the other types of vaccines. I guess one comment in the long run, and we'll talk about this maybe a little bit more, is that the AstraZeneca vaccine may not cover some of the newer variants that are popping up in some parts of the world, as well as some of the other vaccines. But we don't fortunately have those variants circulating widely in Ontario at this point in time. More than 90% of the cases circulating will be covered by both the AstraZeneca vaccine and the mRNA vaccines.
We were fortunate, like healthcare workers and people who work in hospital environments, to be vaccinated a little while ago, at least our first dose, people in like my position at Ontario Shores. And I remember when I was waiting in line, one of our staff, was asking questions, and they're just like, they were wondering, which vaccine they were going to get. Was it the Pfizer or the Moderna? And I thought, we've gotten flu shots for decades. I've never asked once who made them. Right. I was just, it's a flu shot, and you take some things for granted, I suppose. But just given the world we're in, we hear about efficacy rates and this and percentages. Do you think that maybe in some way, like the information around this is actually, it's so great that it might be actually doing some damage in terms of encouraging people to get out there and get vaccinated?
Yeah, it's a great point. I think that the attention, obviously, on COVID has been huge over this last year. And you're right, like the amount of detail that is out there in the media and that people are trying to ingest, and then you try and figure out like what source is this coming from, and is it actually like true, the information that you're hearing? And honestly, sometimes it's just TMI, right? That this stuff is just blurring things. I think getting to the basics is that the vaccines work really well and they're really safe. If you compare them to any other vaccines, they're even potentially more effective and just as safe as any other vaccines that we take. I think we miss that. The other part of this is that the risk of the disease that we're facing is actually quite significant here. You might get lucky. You might be the person that is fine, or you might be unlucky in one of those that end up in hospital. But given how things are circulating, your case very well could result in someone else 1 or 2 generations down the road that ends up in hospitalization or death. So I think the gist of it is the vaccines are safe. They really do work, if we all come together to accept that, we can get over this relatively quickly over the next couple of months. And I don't want to say go back to complete normal, because I don't know exactly when that will happen, but get pretty close to normal. I'm personally even longing for last summer, right, when, if you remember, there were very few cases. It was much safer, especially outdoors, to be together, and at least want to get there again soon.
This I want to ask you, maybe has a bit of a mental health connection to it as well, but I can only imagine with the numbers going up and the ICU numbers going up, and hospitals sort of struggling to build ICU capacity, and everybody on the front lines, and you kind of live it day to day, and just like yourself, and then you come out and you see groups saying hospitals are empty and it's all made up. It must be really mentally hard to live it day and day and then see a narrative that's not even accurate, that's sort of portrayed in the community. And I'm just wondering, what's the morale like among staff, and how do you deal with that when you see these types of conversations that are not even close to being what you're living day to day?
Yeah. So I'll be honest, like the staff have been very resilient, but it is exhausting, and especially now that it's been more than a year into the pandemic, and we're as busy and overrun as we have been through this entire year, that it is tiring. We've had a number of staff that have been have voiced the concern and are trying to pull through this, but it is really, really difficult and taxing. And I can't speak for everyone else, but I'll tell you that I've tuned out some of the media. Like, I cannot go on social media necessarily. I'm on Twitter a little, but much less than previous. But honestly, it is exhausting and stressful to see these things. And maybe I should be out there more, trying to bust through those myths. But sometimes it's just so much more exhausting and stressful that it is, and frustrating, that it's just not worth it when we're dealing with it on the front line, right? So I think that's a good point. I think we'll get through this. We will, but all the team members that have been working through this at our hospital, but also I'm sure at Ontario Shores and across the province, it's going to be a tough go over these next few weeks because of that.
You touched on it earlier when you talked about the reason why you chose to get vaccinated and your oath, and specifically to healthcare workers. Majority of healthcare workers are going to get vaccinated. I think that, I'm not sure what the data is, but I did see something really, positive a couple of days ago. But there are a percentage of people that don't like vaccines, whether it's the flu or COVID vaccine. What would your message be to somebody that may be reluctant in the healthcare industry to get this particular vaccine at this time?
Yeah, so everyone's a little bit different as to why they lack confidence in getting vaccinated. I mean, there are some people that just will not entertain the possibility of being vaccinated with anything, and it's really hard to convince or to have people understand the benefits of vaccination in those groups. That's not the majority. That's, I think, the vast minority. we recently tried to look into some of the reasons why staff are not getting vaccinated, and there's just some basics out there, right? So some of it is misinformation, so that they don't feel that the vaccine is safe enough, and it might be stuff that they're hearing about elsewhere, or someone has told them, or misconceptions or myths about vaccine safety, and so that's why they're not coming forward to getting it. The other is that there's still some confusion about just how effective vaccines are. And through our work with long-term care facilities, there's still questions and concerns that vaccines don't necessarily work to prevent infection or transmission of infection, or keep people safe. And this is despite now seeing, over 95% decrease in cases as well as deaths in our long-term care, weeks after we vaccinated, right? So there's this really clear example within our own community here in Ontario of just how amazing vaccines work. And we still don't have everyone on board. But then there's some other factors, like just the small barriers that we have in place with respect to vaccine rollout, for instance. So traveling to some of the mass vaccination clinics, booking those appointments, especially, for instance, if English is your second language, or let's say you want to talk to a healthcare provider and you've been unable to contact your primary care physician or someone else that you trust to talk about it. Like these are all barriers that are out there that I think are making it so that we're not vaccinating, the vast majority of our healthcare workers. I would say that we're getting there. There are a number of healthcare workers that decided in December or January, when they were first offered the vaccine, not to be vaccinated then, but have kind of come around to it and have, looked at the data, felt more comfortable with other colleagues being vaccinated, showing that it has been safe. I mean, we've clearly shown that even amongst our own team members that the vaccine is very protective against acquiring infection. And I think some people are starting to come around. There's going to be a lot of work to do with this, though they're moving it forward. I think it's going to kind of move from this sort of mass style of vaccination, and I think that's going to keep going until we get enough people vaccinated. But eventually, we'll have to really get out there, and it's starting to happen now with, for instance, vaccination in hot zones or with these pop-up clinics, for instance. But I think we're going to have to continue these efforts to bring the vaccine to the people, to remove those barriers, to answer those questions that are making people hesitant, and get more people vaccinated.
So, strategy-wise, we definitely, I think we saw the efficacy of the first dose, and we want to maximize the supply without getting more vaccines in arms on that first dose. So we've moved the second dose to sort of a 4-month window. I was just curious, for those people that maybe when they're getting up to their 4-month, if something gets delayed or something, do we know much about it if they miss that 4-month window, if we're getting into a 5th month, or how the efficacy is of these vaccines if we don't hit that window?
Yeah. So I guess the short answer is, with the delayed dosing up to 4 months, we don't actually have much data, across the world. It's something that we've done here in Canada, as far as I know, exclusively with the 4-month window. However, there have been a number of countries and other jurisdictions delaying dosing up to 3 months. And in UK, they've actually seen a relatively good response. So, for instance, with the Astrazeneca vaccine, there's also a hint that if anything, the vaccine effectiveness overall, by giving it at 3 months, was even better than the shorter time duration. I doubt that it'll get delayed further than 4 months, and there is a possibility that in the future, if vaccine supply becomes more abundant, that time period will shrink down again. We'll see, but we're not there. We still need a lot more vaccine supply. I will say that there's quite a bit of real-world data now on delayed time intervals to the second dose, and 1 dose of vaccine, if you're counting it from about 14 days after you receive the dose, which is when the immunity starts to kick in, is quite effective. Somewhere between 60 and 80%, depending on the population, of how effective that is. And if you think about it, that's significantly more effective than, for instance, your flu vaccine that you get every year. Now that does go up after the second dose, and so having 2 doses of vaccine is overall better But I think we also have to think about why this has been recommended in the first place. And the reason why is that we know that if you can get more people that go from 0% immunity to 60 to 80% immunity versus people going from, 60, 80% immunity to 90% immunity, you're going to be able to stop the transmission in the community much more effectively. And if you can bring down that transmission in the community, if you can bring down the community rates, then actually it's safer for everybody over time. And that's really the modeling and that has gone into making this decision and why it's playing out that way. And this is a little bit of a hypothesis. It's quite possible by delaying the doses to 4 months that will actually be better protected going into the fall or the winter because you likely will have a longer term memory immune response. And that often happens with vaccines, that if you allow the immune response to kind of mature over time, your cells to mature, then once you get boosted, if you get boosted at a later date, that memory response, remembering the immunity actually lasts longer. So that's a potential benefit. I think we'll have to wait and see how, we'll probably have more data in let's say the fall of next year as to just how well this went.
We've touched on some of the information and misinformation in the media, and even a lot of us would gather information not just from media sources or social media, but from our neighbors, our friends, people we connect with. And when it comes to getting vaccinated against COVID-19, just because I'm vaccinated doesn't mean that I'm free and clear of the pandemic. Can you explain to people what it means to be vaccinated? Can you still get it? Do you still have to be careful? Like when you're vaccinated, what are some of the things that we have to keep in mind?
Yeah, no, that's a great point. So that was my comment a little bit earlier, that there's so much COVID circulating out there. The chance of being exposed out in the community is actually really high right now. That those other public health measures need to be continued even if you're vaccinated. And again, the vaccine is not 100%. I think if it was 100% protected every single person that got the vaccine, I would say like, you're vaccinated, you're good, be free. You're not going to get it, you're not going to transmit it. But that's not the truth, right? So realistically, after one dose, as we said, is probably maybe about 70% effective. So there's a chance that you could still pick up the infection. There's a lesser chance that you're going to transmit it, but definitely that risk is still there of potentially transmitting it, especially to someone who has not been vaccinated. And then everyone's a little bit different with respect to their immune response, and we can't judge it. So the numbers I'm giving you are taking like a whole population together, but maybe your neighbor is on chemotherapy for cancer, and very likely the immune response to the vaccine for them is going to be lower than it is if you're not, for instance. And so there's those sorts of factors that also will come into play here. Again, this goes back to the herd immunity, needing enough people to be vaccinated. And right now, if we're at 20 or 25% of the population vaccinated, that's just not yet enough. I think we need to see what we saw with the long-term care facilities, where you're pushing 80, 90% of people vaccinated within those facilities, residents and staff. That's when you really start to see that herd effect. And we still see cases pop up, but those tend not to result in outbreaks or significant transmissions or severe illness. And I think that's sort of where we need to get to, or the amount of circulating COVID needs to come down to the point where it is then safe. And you know what? Stay tuned. This will happen. Your public health officials will come out at some point, hopefully, in a couple of months or sooner, where we have enough people vaccinated and the cases are low enough in the community that some recommendations will come out saying, like, what, if you're vaccinated, you can get together, or, we're going to loosen up the recommendations with respect to gatherings, and that will come, And, but right now it's just too risky overall.
Just a follow up to that. Sorry, Chris.
Good.
If I've had COVID in the last year, can I still get vaccinated, or should I be vaccinated?
Yeah. So you still should. There is now some data on the protection against secondary infection with natural immunity. So by natural immunity, I mean if you've had COVID before, and it seems to be reasonably high going out 3 to 6 months or so, probably around that 80% range. Now, again, this is in general, not everyone's the same. However, it seems to come down faster than vaccine immunity. The other thing is that we know that if someone's had COVID before and then they get a dose of vaccine, their antibody levels go really high and they actually have a really good immune response. And it's probably much longer lasting. So the recommendation is that if you've had COVID before, you still go ahead and get vaccinated. Your immune response will be much better and it'll be much longer lasting in that situation. Maybe a follow-on to that is, the timing of it. We usually recommend that people are fully recovered from COVID. In the community, realistically, we've been vaccinated some people even 2 weeks after they've recovered. Realistically, you could probably wait a couple months safely after you've had COVID before going for vaccination, and that would be okay because you'll have some immunity there.
I just wanted to, you touched a little bit on the variant of concerns, and I maybe you could educate a little bit. So, we know in Durham that we have a high of the UK variant. I think at like 80% positivity around there. But the vaccine is effective that you had mentioned against this variant. But I'm just wondering if you explain why people need to be more diligent because of the variant as far as the transmission rate and just to be extra sort of careful when they're out in the community.
Yeah. With respect to the variants of concern, that's a good point. There's 3 that are currently listed as variants of concern here in Ontario and by CDC and WHO. There's others that you've probably heard about that are circulating in other parts of the world. In India, there's some discussion about another variant. Right now, that's not called a variant of concern. It's called a variant of interest. The difference there is probably because we just don't know enough about it as to whether or not it's more infectious or associated with a higher mortality. But the ones that are here in Canada, at least that are actively circulating, are that UK variant, which is also known as B117, and that variant has been shown to be more likely to transmit, probably because it's associated with a higher viral load, meaning that people who get infected have more virus, within their respiratory tract, and I suspect the mechanism is that you're just releasing more virus, into your surroundings, and then potentially making it more infectious that way. There was some question about whether or not it was better at entering your cells and causing infection. That's not totally clear at this point in time. It may just have to be more to do with how much virus you're shedding. So we do seem to see that this happens most in really high risk environments. So high risk is inside, especially in winter in Canada, it's dry. The dry air is pretty good at holding the virus in it for a while. And if you're not wearing masks to protect any of these droplets from coming out, or if you're not wearing a mask, it also will allow you to inhale more virus. So you get that load of virus that's necessary to cause an infection. So those are sort of like the higher risk scenarios. And I think the 117 variant has been shown to spread better in these sort of scenarios than even others. So I think just overall, we just need to have more vigilance from a public health perspective. It is harder to control this virus from spreading than the original viruses that were circulating, for sure. But some of the same things apply, right? So masking still applies, distancing still applies, hand hygiene applies. I think in this case, trying to stay outdoors is actually quite helpful, especially if the weather starts to get nicer. I know the snow just melted, but I think the weather forecast is going to be better with some sunshine and warmth. And I think that's a much safer environment. That if we can get ourselves outdoors, it's also kind of good for our mental health and vitamin D too. So.
We've been in this for, coming on 15 months, but we've been in kind of this vaccination mode, I guess, since December. And there's just been so much, and it's not just the media, it's how the governments across the world have decided to roll this out, and priority groups and different things like that. I just saw today that now pregnant women are eligible to receive the vaccine. I know there was age restrictions around Astrazeneca at different times. So somebody might look at that and be like, they don't know what they're doing, because it's like, different changes, different times. Like it's not the way we normally participate in a government-run program. So can you explain a little bit about why these things happen in stages? Like, why now is it okay for pregnant women when the vaccine probably hasn't changed in 5 months, but now it's okay. Same with the age restrictions, like maybe a little bit of the process and why these kind of stages happen when they do.
Yeah, and I totally agree with you. I think when public health officials and others are constantly changing guidance, it gets confusing, and people are less likely to follow it, or you lose confidence. I will say there's actually good explanations for what's happened here with the vaccines, right? So, with respect to the age restrictions with the Astrazeneca vaccine, as you saw, in Europe as well as the U.S., when we first detected these cases, there was a half dozen cases or so in Germany, for instance, of these blood clots. There was still not a lot known about them, and it seemed like they affect the younger populations more. And so, it was decided initially to put a pause on vaccination with those that were those in younger age groups, accepting that the risk benefit might be different. But after acquiring more data, you can actually look at it and say, in fact, the risk in a younger population, 40 to 50, is is only 1 in 100,000 for developing this clot. But we know, like I said earlier, the risk of developing severe COVID is, or being in an ICU, 50 in 100,000. And so, like those risk benefit ratios, I think those changes were probably made just out of an effort to try and be safe and not make mistakes. I think the alternative would have been they could have just kept it and waited for the data to come through, but instead they paused it, waited for the data to come through, and once now there's more comfort with the actual risk benefits, they opened it back up again, and I'm glad they did. I think it's the right decision to make, especially with so much COVID circulating. I think it's actually going to save a lot of lives to lower it to the 40 to 55 group in addition for AstraZeneca. The pregnancy piece is important because early on in the pandemic, we've had a number of healthcare workers that were pregnant and interested in being vaccinated. And in fact, we did vaccinate many, if not most, after a discussion. And the points to touch on are that the phase 3 trials that were conducted back, starting a year ago now, did not include pregnant women. And so off the bat, we did not have a lot of data on the safety or efficacy of the vaccine in pregnant women. It was theoretically safe. There's no reasons why it would not be safe. We give a lot of other vaccines in pregnancy. The only ones we try and avoid are live virus vaccines. This is not a live virus vaccine. It's just a vaccine against that spike protein. And so it seemed to be safe, and we did vaccinate a number of women. And in fact, now in the US, they just released data this last week of about 35,000 pregnant women that received a vaccine, mostly the mRNA vaccine, and they looked at these data and they show that there's no significant poor outcomes. So they looked at things like preterm labor or other consequences, and it seemed that those rates in people that were vaccinated were quite similar to pre-pandemic times. So I think that adds some safety to the vaccine, and that's why now it's been recommended for pregnant women with these data saying, okay, we can now say it's safe. The other part of it is that there's accumulating evidence that pregnant women that develop COVID have worse outcomes, right? So there's a significant increase in preterm labor, of ICU admission, and in other complications in pregnancy. And so that's sort of the risk of COVID. So now that we know the vaccine is safe in pregnancy, and we know that the risk of developing COVID if you're pregnant is high, that's really where those recommendations were to switch, and recommend or add pregnant women to the sort of higher risk populations.
Dr. Ricciuto, do you have any insight on where we are with potential vaccine product for the under 18 and when maybe down the road when we might be looking at that younger population getting access to a vaccine?
Yeah, so I think actually very soon. The Pfizer vaccine is actually approved for 16 and up.
Okay.
And NACI, which is the National Guideline Committee for Immunization in Canada, they actually had recommended that in certain situations you can give the vaccine if you're between 12 and 15. And then just recently, there have been publications of safety and efficacy in that age group, right? So the 12 to 16 age group, and showing that it is safe and it's effective and there's no concern. So it's very likely that vaccination will start to include at least 12 and above relatively soon. We need to wait for Health Canada review and approval, but there's already some discussion about that happening with respect to vaccinating some younger individuals that maybe are at higher risk with higher risk health conditions. As far as children, there are a number of studies that are underway now evaluating the vaccine effectiveness in children and safety, I think is the big thing. Children have not, fortunately, have not, for the most part, developed severe infections with COVID. There have been reports, as we heard, of this inflammatory syndrome that's similar to something else called Kawasaki disease, which can happen. It is fortunately quite rare, but overall the outcomes have been not so severe. That said, especially during this last wave and maybe with the variants, children do seem to be a factor in transmission of infection in the community, and so I think down the road it probably will end up being rolled out. Vaccination will probably end up being rolled out to children as well, in school, so that kids can go safely back to schools without having this run through and then enter the population.
I have one last one for you. This is your life, right? Before COVID, infection control, infectious diseases was a big part of your professional life. And while I can, you've said a couple of times you're looking forward to being outdoors and getting back to normal just as much as anybody. From a career, from a professional perspective, like how fascinating has this been, this journey? The development of COVID, how quickly vaccines were developed and distributed. Like, I'm not sure people, especially those of us who might have overload from time to time that, turn off the news for a couple of weeks at a time might not appreciate, but this is a fairly, obviously a unique time in history, but from an infection control perspective, like it's got to be, I just wonder what your opinion of what the last 15 months have been from a professional perspective.
Yeah, thanks. That's a great question. And honestly, I don't think I've had a lot of time to reflect on it so much, other than to say, and I tell my kids this, right? I'm like, I know it sucks, but you still have to do the distancing. I know we can't see our grandparents, but one day you're going to look back at this and say that you lived through the COVID-19 pandemic, similar to people who lived through, the 1918 influenza pandemic, in a way, because it's truly global. The numbers of people infected, it's in the millions that are reported. It's way more than that we just aren't collecting that data. Sorry, that's as far as deaths. It's I think it's way more than that, and has been way more impactful. And then in fact, we're living it. For me, I'm about 11 years into my infectious disease practice and doing infection control the whole time. I think we were always told, like, it's not if, but when, the next pandemic will occur. I think many thought that it was going to be an influenza pandemic as opposed to coronavirus. That said, despite that and the preparations that were made before, it is really hard to have imagined everything that that has occurred. The difficulty in making decisions, the constraints you have to work around, safety factors, just dealing with uncertainty, especially early on in the pandemic, was pretty incredibly stressful and for everyone involved. And I think we've actually made a point of after things have settled and we're not, scrambling to take care of patients and finding space for our sick patients. As things have settled, we're going to, as a hospital system at least, debrief and really, ensure that if this ever happens again, we are much better prepared as well. And then maybe if I can, your comment as far as, the vaccines and the technology, like it is actually an incredible feat of science. I don't know, I think looking back on history, the development of these vaccines that are safe and effective, for instance, the mRNA vaccines, like less than a year after discovery of the virus is incredible. Like it truly is incredible. Previous to this, it was in the 60s when the mumps vaccine was developed, and that was a previous record. It took 4 years to develop that, and it was very crude. It required the discoverer, who discovered a number of vaccines, to isolate mumps from his daughter and then bring it to a lab and grow it in chicken embryo cells over and over and over and over and over again, and then finally get out to test it. And it was more of more guesswork, honestly. And now the precision of the science to identify the target of the virus that we wanted to target with the vaccine, and to be able to use the technology that already existed with this mRNA technology to roll it out has been incredible. And I actually think that one of the big things that will come of this is that mRNA technology, for instance, will be used for other things. In fact, BioNTech, who worked with Pfizer, their primary role was for cancer vaccines. And I think, this is very promising for some other, hard to treat cancers, or can you develop personal treatments for your own particular tumor by developing an mRNA vaccine, for instance. These are sorts of things that will come from this one day that will look back and say, we really did advance leaps and bounds because of all the investment into the science and technology over the last year.
Yeah, and the collaboration, right? The global collaboration. Yeah. There's very few things that the world can agree on, but getting a vaccine for this was one of them. And the sharing of information that you mentioned, it is remarkable to think, like, as much as we all want this to be over, the fact that, like a year after the pandemic broke out, I had a vaccine and other people had one in December and January. And hopefully by the time we get to the fall, we'll have that herd immunity. And it is, it hasn't been fun, but it has definitely been a marvel of science that we've gotten this far in terms of vaccines. Thank you so much for joining us today. This is great. I really hope that people not only listen to the podcast and take away some of your points, but just get vaccinated. You get a chance, whether it's Astrazeneca, Pfizer, like Johnson & Johnson's coming eventually. There'll be others. I mean, this is going to be part of our life for the foreseeable future. So hopefully people just get vaccinated and we can get past this. So thank you very much for your time today.
That's great. Thank you.
Absolutely. Thank you for having me.
Begins